Welcome back to Midnight Med. This video is on anti-seizure medications. Now, if you've seen our previous pharmacology videos, which I highly recommend, they're fantastic videos, you'll be familiar with the format. We are going to talk about the main types of options that you have for anti-seizure medications, then talk about why one patient may get one kind of anti-seizure med over another, and also look at why they may absolutely not be allowed to prescribe one kind of drug. We're then going to look at side effects and how to monitor it to make sure that the side effects are not outweighing the possible benefits being accrued by the drug. And we'll finish off with some counseling or non-pharmacological methods that can be used in anti-seizures. So these side effects are extremely rare, but they can be applied to all the anti-seizure meds we're going to talk about to varying extents. So the first one is hepatotoxicity, so it affects the liver, agranulocytosis, so a lack of granulocytes. For example, neutrophils, you're losing your neutrophils, which are going to predispose you to a lot of serious bacterial infections. And finally, aplastic anemia, which is serious because it means bone marrow failure. The first kind of drug we're going to talk about is valproate. Now, there are different kinds of seizures, but valproate has widespread use. It is generally your go-to for generalized seizures. It can also be used in focal seizures or absent seizures. Now, this is not a seizure video, but we'll talk about it briefly. Generalized seizures, usually the patients lose consciousness. They may have jerking, myotonic, clonic movements, and they have post-ictal drowsiness. Now, focal seizures, the patient doesn't necessarily have to lose consciousness. They can have just impaired awareness. They can look confused. It can be quite similar to a TIA. Absent seizures, very uncommon in adults, mostly in pediatric populations, and they also look confused. They probably don't have a post-ictal period. Now, adverse effects of valproate include nephrotoxicity, weight gain, and they are teratogenic. They can lead to spinal cord defects, neural tube closure, which you definitely don't want, so don't use in pregnancy. Contraindications, pregnancy, as well as myasthenia gravis. Metabolism, metabolized by the liver, that's why it can lead to hepatotoxicity, and it is a CYP450 inhibitor, so other drugs metabolized by CYP450 are going to be affected. For example, other anti-seizure drugs like carbamazepine, phenytoin, antibiotics such as erythromycin, as well as SSRIs, antidepressive medications. Importantly, COCP, so combined oral contraceptive pill, increases the clearance, so it affects the drug concentration in the blood at any one time, so maybe you have to give a slightly higher dose if the patient's on the pill. The next one is phenobarbital, indications, generalized and focal seizures in kids. Adverse effects, ataxia, depression, hysterism, especially depression and hysterism. Hysterism is increased androgenic activity, so oily skin, deeper voice, pimples, increased hair on the face. So especially for girls, that's a not good side effect. So you've got to be really careful with prescribing that to kids or teenagers who may really not like those side effects. Metabolism by the liver, so again, hepatotoxicity. CYP450 induces, so you think about the CYP450 drugs we talked about, and this reduces the effectiveness of the combined oral contraceptive pill. So if you're taking it, the anti-seizure drug may work perfectly fine, unlike valproate, but the pill would be less effective. So again, another reason to seriously consider giving it to younger girls. Carbamazepine is a common anti-seizure drug, very useful in focal seizures. It blocks sodium channels, but it can also be used in generalized seizures if you can't use valproate, as well as trigeminal neuralgia, interestingly. So again, not a headache video. We have another video on that, but it's trigeminal headache. So you have headache in the trigeminal distribution, may have some ptosis and some lacrimation, eye discharge. Adverse effects, so you have gastrointestinal effects, nausea and vomiting, constipation, as well as diarrhea, as well as neurological effects. So diplopia, that's normally your first side effect. They're going to feel, you can have headache, you can have disorientation. Again, metabolized by the liver, hepatotoxic, as well as CYP450 inducer. Now we're going to talk about how to reduce those side effects later in counseling. This last one, Keppra, again another very common drug use on the ward. Indications are for focal seizures, so not generalized adverse effects. They'll feel more tired, more nauseous, dizzy, once again metabolized by the liver. Now, counseling, it's not all about medications for any disease, especially seizures. So these are things you can teach patients to help enhance the effectiveness of the medications, as well as potentially reduce the reliance on them, and just good hygiene, good addressing of the risk factors. So you want to avoid triggers. Common triggers are sleep deprivation, stress, and alcohol. Unfortunately, they can often go hand in hand. To reduce gastrointestinal side effects, have it with food. To reduce neurological side effects, rather reduce the effect of neurological side effects. Don't drive. You don't want to get into any car accidents. And in terms of the pharmacokinetics, you want to regularly monitor serum drug concentrations to make sure you're at a therapeutic level, so you don't have to, for example, increase the dose of your medications or consider a slow release formula. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.